TNT Open Mind Insights brings you powerful, authentic conversations, illuminating the path to better mental health care for all.
It's really a pleasure. I'm looking forward to, spending some time with you to learn about what you do and to also help me in my world as a psychiatrist for the last 35 years, working with chronically mentally ill patients, families, and systems. I want to continue to be a better psychiatrist. So I'm really looking forward to hearing.
Well, I'd like to be a better person, so
Right, but absolutely. Ultimately,
we both have things to work on.
you're president of the National Alliance for the Mentally Ill of Orange County.
I was president of the NAMI Orange County chapter, it still am,
Okay.
and I was president of the national organization
Okay.
for 2 years.
For the entire country.
Yep.
Okay.
Yep.
And, as a psychiatrist, I valued what NAMI does in the work that I do with patients. And it's one of the first things I do when I come across somebody or somebody's referred to me, almost right when I'm thinking of do they need a medication or not, I'm thinking they got to get into NAMI. Tell me how you got, you came forward in that story of, reaching a leadership position and as a family member of somebody that has mental illness, how that journey has been.
Well, it's been difficult. In 1968 or 69, I was finishing college in Missouri, and my brother lived in Orange County, and he's calling me on the phone telling me that he's learning how to fly, and he thought he would come to Missouri to fly my wife and me back to Orange County.
Right.
And at first I thought, well, that's possible. And then he immediately jumped into making jewelry, and he was getting really good at that. And then there was something else, and he was writing a book, and it was just all I thought, my God, there's no way you could be doing all of these things. So needless to say, I decided we'd come to California a different way than flying with him. And then he lived in Westminster. We got to California. He lived in Westminster at the time. And of course, I wanted to see him, and I just didn't understand what he was going through. And he sensed that I didn't understand, and he would get very angry. And of course, in his mind, there was absolutely nothing wrong with him.
Right.
He was, smarter than most people.
Yeah.
And typically, people with serious mental illness are smarter than most people. Not a little bit, generally quite a bit. And so, we would engage with each other on a fairly regular basis. At one point, we got an 800 number put into our home phone because this was in the days of payphones.
Yes.
Not cell phones.
Right.
And we got an 800 number, so no matter where he was, he could call me.
Right.
And there were times when he was so sick he didn't remember his name, but he always remembered the 800 number.
Okay. Right.
And of course, there wasn't always a whole lot that I could do. But that's kind of what drug me into NAMI.
Did you find yourself as like the point of contact within the family?
Well, the rest
that
of
point?
my father was a chaplain in the Army,
Okay.
and the rest of the family was spread all over the United States. So I was closest.
Okay.
So it was kind of a natural step for me to take. My mother and my mother was also a minister. My mother used to say, well, Stephen, I think you finally found your calling.
Okay.
That is taking care or helping my brother take care of himself.
You were a young man at that point.
Yeah, 30.
30 years. Okay.
30.
Beginning your career and just trying to find out where your path also.
Yeah. And I just didn't understand what was going on, to say the least. And I'm trying to remember how I was first introduced to NAMI. And of course, the question is that NAMI or NAMI? Well, it doesn't matter to us. But the fact that people know the name now, and I got a call earlier this week from someone who'd gone to her psychiatrist, and he said to her, have you ever heard of NAMI? And she said, yeah, my father's the president of the board of NAMI. But it's nice to hear it coming back because it means that we're beginning to penetrate the conversation.
Okay. Now, in those early stages, as it sounds like you were appointed within the family as the de facto overseer of your brother. How was it for you to then communicate with your parents and maybe other siblings? Because you were there on the front line.
Right.
How was that?
The first thing that I found notable, and there were 6 kids in the family. John was the oldest.
Okay.
And when I would talk to them on the phone, they would never say, "So how's John?"
He was like,
They would never mention his name, which I thought was strange.
okay.
And then there was a piece of me as we continued down that path where I began to understand, well, I think they think I will tell them if he dies or if he's in the hospital.
Okay.
But they were with him when he first started to manifest this in Okinawa.
Okay.
And it was a very, 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 very difficult time for the younger 4.
Sure.
And I think I don't think it's fair to say they wanted to wash their hands of it, but they had some pretty horrendous interactions in Okinawa. And so they wanted to get as far away from it as they possibly could. Yeah, and at first I thought, my God, he's your brother, and you don't even ask how he's doing. And then as I grew to understand, it had such painful memories for them, they just wanted to discuss it. I remember at one time, I thought, gee, it would really be interesting to see what the 5 younger siblings, including John, be interesting to see what they remember about this.
Right.
And so I called them one at a
Yeah,
time.
yeah.
What do you remember when John started having problems in Okinawa? Well, the 4 siblings didn't really want to talk about it very much. But John, when I called John, it was like somebody had ripped a scab off an open wound.
Okay.
And he was just alive with anger and frustration and all sorts of things. And that's interesting. Another interesting story, the first psychiatrist my parents took him to was an Army psychiatrist
Okay. Yeah.
named Scott Peck.
Okay.
Wrote a book, The Road Less Traveled.
Yes. That's Scott Peck.
That's Scott
okay.
Peck.
Yes. Yes.
And my 4 siblings were there. John was there. My parents were there. And Scott Peck turned to my mother and he said, well, you do understand that you're the root cause of all of his problems, don't you? And then turned to my father and said, anything she's not liable or responsible for, it's you. And clearly you have a dysfunction.
Were you there?
I wasn't. I was in college.
Yeah.
And so when I tell that story in front of a group of therapists, they say, well, when was that? Well, it was about 68, 69.
Yeah.
Well, you got to understand, 68 or 69, we had a different view of all of this than we do now. And so then my question to them is, so why do you have his book in your bookcase?
Yeah.
It's not in the history section.
Yeah.
It's right there with everything else.
Right.
Of course, there's no answer to that. But I think you're familiar with Javier Amador.
Yes. Yes.
And he spends a lot of time talking about you can't keep throwing. Well, sure, you're mentally ill, obviously. You can't keep throwing that at them. And did you take your meds?
Right.
Because you're just distancing yourself from them.
Yeah.
And so his approach, as I understand it, and he's talking now about serious mental illness, his approach is he's your brother and you need to love him and he needs to feel comfortable around you. And if you keep throwing that at him again and again and again, he's going to push you away.
Right.
So you have to have a familial relationship. He is, after all, your brother. And I certainly loved him. That was never in question. But it kind of brought a different perspective on the whole thing. Because I, like so many, John, did you take your medication today? John, how much sleep did you get last night? John, da-da-da-da-da-da. Well, he was my older brother.
Yeah.
And here I am questioning him, and he found it offensive. And the more I think about it, I probably would have too.
Did you find yourself, especially with the reaction from the other siblings, the emotions that you had that were emerging, be it anger and maybe toward other family members, like this was now put onto you as the primary caretaker?
No, I didn't.
Okay.
I didn't. I gladly embraced the whole thing.
What in your background, like that's wonderful to hear. because you so often hear people become disengaged from families, become homeless.
It just happened last week.
Last week, you see it all the
Yeah,
time. You get those
exactly.
calls. But what was unique in yourself that made you embrace this and become a better person? It-
You know,
It's a
that's
tough question.
that's a great
Yeah.
question. You know, I try, not always successfully, but I try every day to be better than the day before. And I try to treat everyone with dignity and respect and kindness, no matter, you know, if they had cancer, I certainly would
Okay.
treat them that way. And mental illness is not a whole lot different. And so I try to treat those folks that way. And I think for the most part, and I just think it's the right way to be.
Yeah.
And to the extent that I'm able to do that, I want to do that.
Okay.
Uh,
That it's a special person. You know, speaking as a psychiatrist, not everybody is able to do that. That's our belief, but not everybody can embrace that. Um, the other, you know, now in an organization that really helps educate families, uh, and to myself as a psychiatrist, I feel the only is a strong word, but to be able to navigate this illness, if you have schizophrenia, you do your best to keep the family somewhat intact. This is a very difficult illness to navigate by yourself and the mental health system and psychiatrists and case
so-called
managers.
system.
Yeah, so-called. You need a family. I try to bring in the family as soon as possible at the very beginning.
My hat's off to you because that's not the norm.
Is that still how you feel in
Oh,
the
yeah.
all that
Oh, yeah.
we don't?
I have parents call me. I'm trying to give the doctor
Right.
information about my brother,
Yeah.
how the medications are affecting him positively or negatively, and they will not return my calls. I hear that all the time.
Yeah. I hear that all the time too.
And one
Yeah.
guy, not far from here, I don't remember his name, fortunately, so I
Yeah,
keep it
right.
secret. One guy, when I finally got him in his office, and I think I would have reached across the table and choked him if I could have. But when I told him that I'd called him at least 6 times, my daughter had called him a half a dozen times, and he never returned a single phone call. And he sat there and he said, "My nurses never gave me the message." And I thought, bullshit.
Yeah.
You know, none gave you a message. I just don't believe it.
Yeah. Let me. I totally hear you. That has been happening ever since I've been in psychiatry, and we hope it will get less.
Yes.
But let's be real, it will continue also.
Yes.
And I sometimes see psychiatry as, even for a non-clinician, you can somewhat pseudo master it. I tell families right away, you learn about the medications, learn about what's out there. You become a semi-extension
Yes.
of a psychiatrist. You can put an MD behind your name
That's
if you
great
want it.
advice.
So
Most of the
you
people-
guide. Yeah.
Most of the people that I know through NAMI
Yeah.
welcome that.
Right. I mean, you tell me what needs to be done. Yeah, we have lots of treatments and all, but you know, it's medications, it's the biopsychosocial treatment, it's NAMI. It can be mastered. Uh, so, you know, I want that family to guide me. Those families that are more engaged. I'm a human being. You know, I get more engaged when the family is there and they're sharing ideas. It sounds
Are there more of you hiding out there somewhere?
you know, they may not share that or they may say it in a way, but I think most people in mental health are more like that than maybe they've conveyed to families.
Well, that's
They-
fair.
I
It's
yeah.
hopeful.
I do. What do you want to tell us as mental health specialists, not just as psychiatrists, psychologists, case managers, police? I mean, I, what do we need to be doing to make sure you don't get burned out and exhausted as a family? Because once that happens, I think outcome goes
Right.
in the wrong direction.
Right. That's a great question.
Yeah.
What I would like to see psychiatrists, clinicians of any kind do,
Sure.
is I would like for them to be open to the perceptions of the behavior of the family.
Mm-hmm.
In other words, John's taking his medication, at least we think that he is.
Right.
And here's what we see in terms of his behavior.
Yeah.
And I would like routinely for psychiatrists, because they're the ones prescribing the meds, for them to tell me as a family member, how long is it going to take before I see some kind of change? You know, this is going to take 2 weeks or 3 weeks or a month, because most of us have grown up on antibiotics and we think if
Right.
we're not feeling better the next day, it's
Okay.
not working.
Right, right.
But in the psychiatric kind of medications, that's not always the case.
Right.
So I think it would be very helpful to know, I want you to watch this for the next 3 weeks or 4 weeks or whatever it is, so that we can find out if it's working.
Mm-hmm.
And I want you, to the extent you're able, because he may or may not be living with the family,
Right.
how many hours of sleep he's getting,
Okay.
what kind of exercise, what he's eating, all of those kind of things, because you have the knowledge to know that he's heading down a good path, or there's some problems here that we need to address. And most, again, I almost feel guilty.
Yeah.
Most psychiatrists do not do that.
Right.
They do not do that. They do not welcome the interaction with the family at all.
Yeah.
You know, they know what they're doing,
Yeah.
but feedback from the family is not something they seek.
Right.
And I think it would help if we were all working on this together. And without that information, how do they make judgment?
You just made me think of a real novel idea. What do you think? Don't rely on the psychiatrist to direct somebody toward. How about when that family and or individual with the illness goes to the pharmacy and the pharmacist knows, oh, this is an antipsychotic or this is a mood saver.
Sure.
Why not at that moment they give them a piece of paper saying,
Call
NAMI.
That's a great idea.
I mean,
I'll take it.
take the mental health specialist out of it. The prescription obvious is, and if it isn't, so it isn't.
Yeah. That's a great idea.
Yeah. Do you have enough people at NAMI to potentially absorb the number of people that need NAMI?
We don't have any trouble when people
Yeah.
are in that kind of predicament with a family member.
Mhm.
We don't have any trouble at all getting them to volunteer
Okay.
to do something.
Right.
They'll do anything they can.
Yeah.
And sometimes, frankly, it's better if they are helping elsewhere rather than their own family member, because they're so engaged with their own
Right.
family member, it's hard to be objective. But I don't think that would be difficult at all. You may or may not know that NAMI runs a warm line.
Yes, I'm
You know,
familiar with that. Yeah.
We're over 1,000 calls a day.
Okay.
And
So,
and the county is cutting back.
right.
They're cutting our budget by like
Yeah.
60, a little over 60%.
Okay.
And sadly, most of the people who work for the warm line have a mental illness.
Yes. Yep.
And now we're going to be
Some-
laying them
some
off.
my patients work with
Yeah.
warm line.
So
Yeah.
anyway,
And that also made me think, as a psychiatrist, especially with people that are going into 20, 30 years of illness, I'm not just taking care of that person who has that illness. I'm taking care of the family also. And I don't.
where have you
No,
been?
no, I mean, I hope more people, they may not be conveying that to you, but I do think more people are in that. At some point, I have to realize I want to make sure you have quality of life as parents who I see aging in front of me over
Oh, yeah.
25, 30 years. And usually it's the mother at age, 40 years into illness that is
I
like
teach family to family
Yes.
classes. First thing I do when I walk in the room, new class,
the mother.
count how many are people in the room, count how many are men.
Yeah.
If more than 25% are men,
Oh.
it's very unusual.
Yeah, I believe.
And dads just bail out.
So,
Either mom, you take care of John and I'll bring home a paycheck, or they get divorced.
right.
And it's the
Abs-
mom that's left with the problem, and the moms don't ever walk away.
They never do. I mean, they're the ones that are, every night, with the medications come to the point. So, as a psychiatrist, I want both of you as in parents or siblings, to be able to fulfill what your hopes were in your life. How do I extricate that guilt of your enjoying your life, knowing your son or daughter is still struggling and getting hospitalized, misusing
Well,
drugs?
undoubtedly,
But you have,
you've seen the research
right.
about the lifespan shortening for support people.
Yes.
15,
Yes.
20 years is not
Absolutely.
unusual. And so I think that's one piece of information
Right.
that families should have.
Yeah.
You know, you cannot carry this alone.
Mm-hmm.
And so NAMI, as you probably know,
Right.
has support groups
Yes.
where the moms are and dads sometimes
Right.
are all in the same room talking together
Mm-hmm.
and giving each other support, not unlike an AA support group,
Right.
frankly.
Absolutely.
But I wanted to tell you something.
Yeah.
You probably won't ask the question, so I'm going to.
Please.
So my parents, to let you know how committed they were.
Yes.
My father retired from the Army in West Covina,
Right.
or they were living in West Covina at the time. And my mother said, well, listen, since we're not going to
Yeah.
be moving every 2 years, I'm going to go to graduate school and get a marriage and family
Okay.
counseling license.
Right.
They were both in their 60s at the time.
Yeah.
My father said, well, I'm not moving either, so I'll do it too.
Okay.
So they both became licensed
Yeah.
marriage and family because they were trying to find answers
Right.
for my brother.
And coming back to, I see, parents and son or daughter affected by the ill. If I can't help that child as much as I'd like, let me at least help the parents
But in helping the parents, you are
are
helping.
helping. Right. You're absolutely right.
At least that's the way I see it.
Do you find we should do that, convey that more clearly
Oh, yes.
to families that,
Oh, yes.
please go on that trip.
Yes.
Please pursue. You have other siblings
Yes.
and other children. I mean,
Yeah.
that need you, and grandchildren.
We embrace you as part of the solution.
Yes.
That would be huge.
Yeah.
If that's the only change you made in your professional
Right.
life, that would be huge.
Yeah.
And more often than not, at least from the people I talk to at NAMI Orange County, that's just not the case. Not even close.
We've touched on some of the things we should be doing that we can do today. Where would you like your education of clinicians to be 5 years from now? What more, like legislatively or programmatically? What's your wish list? What's low hanging
Low-hanging
fruit?
fruit. There you
Low
go.
hanging fruit.
This is going to surprise you.
Okay.
I think psychiatrists should be paid more.
Okay.
60% of the counties in the United States do not have a single psychiatrist.
Okay.
60%. For every 13 new clinicians, and now we're talking about PsyDs, licensed clinicals, those folks, for every 13 or every 10 new ones we get, 13 leave the field.
Okay.
And there is no way these problems will be solved just by families and the psychiatrists that we have. No
Sure.
way. We've
Sure.
got to have more. And that's why Dr. McCarran's work, in my opinion,
Right.
is so vitally important. We have to have more.
Right.
And they need to be paid to do it. They did a research project on 5 different billing codes
Okay.
in a particular sequence. Billing codes that psychiatrists could use,
Right.
billing codes that family practice doctors, internists, there were 3 or 4 different. And every single time the psychiatrist got paid the least for exactly the same thing. That's
Right.
ridiculous.
Yeah.
Makes no sense at all.
Okay.
So I think they should be paid more. I think they should be paid a fair amount, because one of the reasons we have a shortage of psychiatrists is they don't get drawn to the field
Right.
like a cardiac surgeon or something like that. So I think they've got to be paid more if we ever are going to get on top of the
Right.
problem.
Yeah. I mean, you mentioned like programs such as the Train the New Trainers program, whose the mission being educate people in the primary care, be it pediatricians, family medicine doctors, internists, often the point of first contact.
Right.
That's
That's exactly right.
It's hard to get to that mental health person, the stigma. I don't want, I'm not so sure if this is mental illness or what else is going on.
Yeah, if we ignore it, it might go away.
Ignore. But at the same time, we have to be careful overburdening primary care with now being a junior mental health specialist. There has to be a sweet spot, because that's where mental health care is taking place for a large number of people, in the United States. Any thoughts about that? Like we need to protect our first line,
Right.
help
Right.
practitioner.
Yeah, that's not an issue that I've considered too much, and I don't want to just wing it,
Wing it.
but I will think about it.
Yeah. I'm not sure within the NAMI as a whole, or even here in Orange County, there's a concept of contingency management, where actually paying people to stay on treatment. That's moving forward legislatively. It's happening in other illnesses, and people are wondering, maybe mental illness is the primary place because it's a brain illness.
Right.
actually paying patients to stay on
Be
treatment.
good patients.
Yeah. What do you think? I mean, thoughts of that from a
Never, just off the cuff,
yeah,
because I've
please.
never thought about
I
this
want.
before.
I'd love to. Yeah.
Um, when my brother was resistant to medications, you could have given him $1 million and he wouldn't have taken it.
Okay.
Or he would have taken the $1 million and thrown the medication away. So I don't know. Maybe there's a point where somebody's med compliant for a certain period of
Yeah.
time, and then the
Yeah.
the tool could be
Yeah. It may
used.
be selective. It may not be a fit for, but if as you know well, Steve, if we can keep people on treatment, the likelihood of
Makes a big difference.
staying well.
It makes a big difference. But it's more than just meds,
Right.
obviously, and the rest of it can't be ignored.
Now, you do a lot of legislative work in your role.
I'm asked for my opinion periodically,
Okay.
but I wouldn't say that I spend a whole lot of time
Okay.
in Sacramento. No.
Right. As you talk to, like, let's say your board of directors, those who actually go to Sacramento or Washington, D.C., do you feel the receptiveness of decision makers is better today than 5 years ago? Like when legislation comes up that has to do with schizophrenia or some of these chronic mental illnesses, are they appreciating that, or their offices?
Well, it's interesting. Daryl Steinberg,
Yes.
you know,
Yes.
or suspect, no longer involved in state government,
Right.
but he came to speak with us once at a NAMI convention,
Yes.
and he said, "I love NAMI,
Yeah.
love NAMI."
Yeah.
He said, "I could take any 15 people in this room into a group of legislatures, and you'd have everybody in the room in
Yeah.
tears in 15 minutes."
Right.
And then he said, "But folks, we need numbers,
Yeah.
the metrics."
Right.
And of course, I think he's right. We need to be presenting ideas that actually work, and it's not always medication, although many
Absolutely,
times it
you're right.
is.
Well, by numbers, you mean we need more families.
No,
We need more.
no. He meant that the things that we do that seem to work, he needs to know how many people are in that group and how it affected them. What are the metrics that prove that this really works?
Sure.
And you may know that
Yeah.
family to family class is
Right.
evidence-based.
Yeah.
Uh,
Right. You have data if you are
That's-
part of that program.
That is
Yeah.
exactly right. And it's not inexpensive
Yeah.
to do that. But we did do it for family to family.
No, I would agree. I mean, ultimately, it does come down to like dollars.
Yeah.
And if we do have this program, will it lead to a better outcome and save money?
Yeah.
If you can meet those two benchmarks, you might have
You're home free.
a
At least
legislator listen.
At least you're close.
Yeah.
Yeah.
Do you need help in getting more data? I mean, are you is
Interesting that you would ask.
Yeah.
We mentioned the warm line earlier,
Mhm.
and the number of the county has slashed our budget,
Mhm.
so it's not going to be the same come July 1st that
Right.
it is now. But I'd like to be in a position that we could say those 17-minute phone calls really make a difference somewhere down the road.
Mhm.
That these people or this person is not hospitalized as often or for as long, or
Mhm.
some way of saying that it's something beyond a simple phone call.
Mhm.
And as you, I'm sure, can guess, an awful lot of the people that call the warm line are just lonely.
Yeah.
It's
Yeah.
2 o'clock in the morning.
Right.
They don't have anybody to talk to.
Yeah.
And so they get on the phone with people at the warm line. But what's the impact of that? Simply more than simply, I call them because it makes me feel
Right.
good or something.
Right. I'm now, as I've gotten older, I've become a believer in community service. Because I think I get so much more than what I'm giving. I'm even thinking like, right. I mean, because I connect
I know
with people.
that feeling.
Yeah.
Yeah.
But what about high school students or undergraduates on at UCI? When they're not those who are just interested in the healthcare, but I think if they could have an opportunity to work with NAMI and help support what you're doing, spread the word, they're going to become.
Well, we have a program
Yeah.
called NAMI on campus
Okay.
for colleges and high schools,
Okay.
and they would fit right in.
Right.
with
What
that.
what do they do? Are they just working.
At their own schools,
Okay.
they have speaking engagements talking about mental health.
Okay.
NAMI, as you may or may not know, has thought many times about changing its name
Yeah.
from National Alliance on Mental Illness to the National Alliance on Mental Health,
Okay.
because health is not nearly as stigmatizing
Right.
as, I've got schizophrenia.
Yeah.
So we haven't yet taken the leap, but I think it's important to know that mental health kind of is the gateway, and it's either going to, depending upon your mental health, going to lead you toward mental illness or lead you away from it.
Right.
And I think you're absolutely right in your comment about community
Yeah.
connection. I often say, put your cell phone down and get connected,
Yeah.
because you can't do it on your cell phone.
Yeah.
It's better than nothing. We
Yeah.
learned that in Zoom
Right.
and the COVID pandemic, but it's not the same.
Right.
Because if I come up to you and I say, "Hey, how are you doing?" "Hey, fine." No.
Ye-
I mean, really,
Yeah.
you get a completely different answer the second time. And somehow Zoom doesn't bring that to light.
No. Well, what you just did, you made that extra step. I might have said, I'm fine, but you then,
Well, don't we all?
yeah, but then you allowed me to now open up.
Yep.
I'm going to think about my response of fine a little bit further.
Yeah.
Yeah.
Well, and I find myself saying, really?
right.
Are you asking me?
Yeah.
You want to know the whole thing?
Right. Right. Well,
And oftentimes, of course, they
Yeah.
don't. So
this has been wonderful to not just hear your story, but the importance of keeping families engaged, supporting them. Ultimately, we want the best outcome for the person that's afflicted with the condition, and we don't want to rely on the mental health professional community. In some ways, I think they're
it's not enough.
yeah, and I almost feel it's less than 50, more than 50% is keeping the family intact and supporting them to get to the goal that we want. So keep up the work you're doing. Keep getting more families engaged and
Stay connected.
stay connected. And our job is to make sure families go to you at the same time they go for their first prescription.
And of course, we have the peer-to-peer classes too,
Right.
for those living with a mental illness.
Right.
But it's hard for them to go to those classes because
Yeah.
you kind of got to say,
Yeah.
it's like saying you're an alcoholic. I don't really
Yeah.
want to do that.
There's never a perfect fit, but we'll take 20% of some benefit and 80% of
Yeah.
not a good fit.
Well, I really enjoyed talking.
Yeah, you bet. That was wonderful.
I wouldn't have saw you as a psychiatrist, so I was a little bit
Right.
surprised
Yeah.
when you came clean.
Sure. I came clean. No, this is it's no fun doing. I don't want to have all this burden on my shoulders. We're a team.
Well, again,
Yeah.
the solutions will come from the community.
Absolutely.